My name is Jeong-Mo Park. I work in Gyeongil-Women's University as professor. Research theme which I am going to present today is factors related to unmet help needs of elderly with cognitive decline. Professor Kim was co-worker in this research work. She is professor in Sangmyeon University Nursing Department. This research background is as follows. As of 2021, the estimated prevalence of dementia among the elderly population aged 60 or older is 7.24%. It is estimated that the cost of dementia management in 2021 amounts to about 19 trillion won. The progression of cognitive decline due to the increase in the elderly population and the increase in dementia patients have emerged as social problems. The purpose of dementia management is to keep cognitive and daily life function from getting worse. Cognitive decline and their families demand help. That is, help barriers such as psychological, social, biological, medical. In order to meet the help needs of elderly's cognitive decline, available resources at the individual, demographic, and social level, such as income and the presence of caring families. Community level resources such as dementia care centers and daycare facilities. National resources such as long-term care insurance and delivery systems are included. In the face of trend changes such as rapid aging and an increase in the proportion of single-person households, communities and society need to bear the care problems of elderly with cognitive decline. So, this study aimed to identify factors related to the unmet health needs in the elderly with decreased cognitive decline, cognitive function. We will try to analyze three specific objectives to identify research purpose. At first, identify the difference in demographic and sociological characteristics between the elderly who received help hereinafter met health needs or met health and elderly who did not receive help hereinafter referred to as unmet health needs or unmet health. Second purpose is to identify demographic and sociological factors that affect unmet health needs. Third purpose is to identify the difference between cities and provinces of factors related to unmet health and the difference in the unmet rates by city and province. We used secondary data for research purpose. The secondary data we used is Community Health Survey 2019. This data is surveyed nationwide every year. Data for 2019 were used in this study. About 74,000 secondary data of people aged 65 years with cognitive decline who need help was analyzed in community health survey. Unmet health needs means they did not get help when they needed help related to their cognitive decline. We use the SPSS21 statistical programs. Uh, Data over 65 old age in community health survey were about over 74,000 who has experience of cognitive decline were 21,871 uh, who needs help in daily life in old person with cognitive decline was 208 persons who was met in help need was 1,317 of 2008 persons who was unmet health needs was 337 persons of 2008 persons. The results of this research is as follows. Living alone, income, and age were identified as factors related to unmet needs in the elderly with cognitive decline. The elderly who were engaged in economic activities and low age groups were high in demand for help and were not satisfied. So we should be interested in receiving help in these groups. The main factors influencing the failure to meet the demand for help were living alone with low income and young elderly. In addition, there were regional disparities in factors of unmet, and there were areas where two factors overlapped. We analyzed the differences socioeconomic characteristics between old person with cognitive decline who need help and old person with cognitive decline who does not need help. Also, we analyzed a difference of socioeconomic characteristics between who was met for help and who wasn't met for help in old person with cognitive decline. Result is as table. More women than men, more old age group than young old age group, more living alone than not living alone, need for help significantly higher. In case of no spouse, in case of less income, in case of not having a current job, in case of lower education level is needed more help significantly. Simple logistic regression and multi-variable logistic regression were used to identify factors influencing unmet needs in elderly with cognitive decline. Age, whether live alone or whether live with other person, whether with spouse or no spouse, whether having a job or no job, and annual income are influencing factors in simple logistics. Younger elderly, living alone, annual income were factors influencing unmet needs in elderly with cognitive decline in multivariable logistics. The younger, the more unmet needs. The unmet needs was 2.53 times higher than that of the elderly who did not live alone. Annual income of 5 million won, Korean won, was 0.63 times higher than that of 40 million Korean won. In summary, woman, living alone, no spouse, low economic level, and low education group had high health demand and high unmet needs. On the other hand, the young old age group and the economically yet active group showed a high level of need for help, but a low level of unsatisfaction for help. There was regional differences in unmet needs in elderly with cognitive decline. Jeonbuk and Jeonnam were highest age region, and Daejeon, Ulsan were lowest age regions. Jeonbuk, Jeonnam were the lowest income annual regions. Seoul, Gyeonggi were highest annual regions. And Jeonbuk, Jeonnam, Gyeongnam were highest proportion regions in living alone, and Seoul, Gwangju, Daejeon, Gyeonggi were lowest proportion in living alone. Highest region in cognitive decline experience were Gwangju, Jeonbuk, Jeonnam, and Gwangju was highest region which was unmet in help. So we have conclusions as follows from this research. Having alone, income and age were identified as major influencing the failure to meet the needs of the elderly with cognitive decline. Social attention in this part is required. Factors that did not mean the help differed depending on the region, and there were also regions where the two factors overlapped. As a result, in the difference in the unmet rate by regions, there is a difference in the need for help, and the unmet rate depending on the region, such as regions with high help demand but low unsatisfaction, and regions with low help demand but high unmet. It is necessary to consider the resources and services that can assist those with unmet needs due to cognitive decline. Systematic efforts by central local authorities to narrow socioeconomic differences related to unmet needs and to reduce regional disparities are needed. This concludes the presentation. Thank you for listening.